afternoon, ladies and gentlemen of the press. Tonight I am joined by the Chief Medical Officer, Dr. Oyinloye, as well as Dr. Carika Weldon, who is the Director of the Bermuda Molecular Diagnostic and Research Laboratory. Current status of Bermuda is as follows. Bermuda currently has 31 active cases, all of which are persons under public health monitoring, and no one is in hospital. Of all active cases, 26 are imported, 2 are classified as local transmission, and 3 are currently under investigation. We have undertaken genome sequencing on all of our active cases, and while most of them are the Delta variant, one case is the Omicron variant. The sequencing was done by MDL Lab, and it indicates the presence of Omicron in one imported case identified over the weekend. As this is the first time a local laboratory has completed genomic sequencing for the Omicron variant, this sample will be also sent for sequencing overseas as part of our quality assurance processes. This is the same quality assurance processes that were highlighted last week, which involved 33 samples being sent overseas. Unfortunately, we do not yet have the results of that analysis from the U.S. lab, but expect to have those results this week. It is important to remember that we have very strong surveillance in Bermuda, so the contact tracing for this active case is completed, and the close contacts are in quarantine. We only have the one case at this time. The government has proceeded slowly in relaxing our border protocols. So unlike other countries, which are hurrying up and reimposing testing and quarantine requirements, our existing sound testing and surveillance policies are working to our advantage. The Omicron variant was identified quickly, and in our view, there is no need to panic. Successful public health measures such as SafeKey supplement our testing and surveillance policies, and together are effective in reducing transmission of the virus which causes COVID-19. As a reminder, however, those people returning to the island who are not vaccinated must quarantine for 14 days. If you cannot quarantine alone, then the entire household must quarantine with you. If the household cannot or will not quarantine with the traveler, then the traveler must do the 14 days of quarantine in a hotel, guest house, or Airbnb at his or her own expense. Our current case numbers are encouraging, and our CDC travel health level notice is at level 3. The WHO and PAHO no longer track country transmission levels, but Bermuda's indicators would place us at clusters of cases. With respect to vaccines, to date, 71.9% of the population has been vaccinated with 1 dose, and 70.3% of the population has been immunized with 2 doses. Additionally, 24.1% of the population have received a booster. I've said many times, vaccination remains the best protection against the virus, and in Bermuda, it is easy to get vaccinated. COVID-19 vaccinations are available at the Hamilton Health Center, which is 67 Victoria Street, every Tuesday from 2 to 4 p.m. These vaccinations are by appointment only and no walk-ins. You can also get your first, second, and third dose there. Call 332-8906 for assistance in scheduling an appointment, or you can book online at www.gov.bm/vaccines. Additionally, until the 22nd of December, first and second appointments can be made at the KEMH vaccination clinic on Tuesdays and Thursdays between 4 and 7 p.m. and on Saturdays between 8 a.m. and 4 p.m., and walk-ins are accepted. You can book online at, again, www.gov.bm/vaccines, or call the vaccination hotline at 444-2498, option number 2 for assistance. For those eligible for the booster vaccine, please book an appointment on thegovernment.bm by selecting Book a Booster Vaccine Appointment. Alternatively, you can call the vaccination hotline, again, 444-2498, selecting option 2, or email vaccines@gov.bm. Those persons 65 years of age and older can walk into the Pier 6 for their booster and throughout November and December, and KEMH booster clinics will be held on Wednesdays from 8 a.m. to 8 p.m. and Sundays from 8 a.m. to 8 p.m., and the last clinic is on the 23rd of December. Please note we are coming to the end of our mass phase of the vaccination campaign, and I encourage everyone who is eligible for a first, second, or booster jab to get it before Christmas. The last clinic at KEMH will be held on the 22nd of December and at Pier 6 and the Hamilton Health Center on the 23rd of December. In the new year, vaccinations and boosters will transition to other outlets on an appointment basis only. The details of this transition are being worked on now, but I would like to take this opportunity to thank the physicians and the pharmacists who have stepped forward to express an interest in delivering the vaccines, and we look forward to working with you. Overall, I can say that things are improving. However, to help reduce the further spread of the virus, I encourage everyone to be cautious and avoid the 3 C's: closed spaces, crowded places, and close contact settings. This is especially important as we come up to the festive season. Each of us has a role to play in stopping the spread of the coronavirus. Follow public health guidelines, continue to wear your mask indoors and outdoors if you cannot physically distance, practice good hand hygiene, maintain physical distance, and download the We Health Bermuda app. I'd like to now turn you over to the CMO, please.
Good afternoon, Bermuda. Today, I will be following on from the Minister, and I'll be talking a little bit about this new variant of concern named the Omicron variant by the WHO, the World Health Organization. So what I'll be doing today is a little bit of discussion around that, what we know about it, and also what we can do to protect ourselves. Following me, Dr. Weldon will be talking about specifics of what we have done in Bermuda to identify the case that the Minister has just described. So, 26th of November this year, just a little over a week ago, the World Health Organization reclassified the B11529 strain that was first discovered in South Africa 2 days earlier as a variant of concern. And the name given to it in the Greek alphabet is the Omicron variant. Why did they think that this was a variant of concern? This variant has a lot of changes in it. So about 50 changes in total have been identified in it, much more than any of the other variants that we have been worried about earlier on. 30 of those changes are on the spike protein, which is a target of most of the vaccines and most of the monoclonal antibodies that we have developed so far. And this is why it's being called a variant of concern. Further analysis has shown that there's quite a bit of similarity between this variant and the coronaviruses that causes common cold. So shows us that there is this virus is doing what viruses are expected to do, which is to mutate. Initial analysis have shown us that this virus, is much more transmissible than the Delta variant that was the main driver of the outbreak that we just had in Bermuda. However, at this stage, most of the cases that have been seen so far have had mild symptoms, and there has not yet been any deaths recorded from this as of yesterday. It's very early days though, because much of the information that we have from this is from South Africa, where the Delta variant has not been the dominant strain. It's not had the kind of outbreaks that we've had in Bermuda and much of the northern hemisphere. So we need to have a lot more data points before we're able to very clearly describe how this virus behaves. So, as I mentioned earlier on, there are quite a lot of changes on the spike protein that we've talked about in the past, and this is a target of a lot of vaccines, a target of a lot of monoclonal antibodies, and indeed laboratory studies have shown that they are able to escape the protection offered by some of the monoclonal antibodies that have been approved for use across the world, basically. What does this mean for us in terms of vaccine efficacy? You remember I have talked about the various ways the vaccines work. Part of the ways is there's a production of antibodies, which is basically proteins, special proteins in the body that recognizes the spike proteins of the virus, attaches to it, and makes it easier to be killed. That's one arm. Simply put, there's another arm where we have plasma cells, which are the body's memory cells that allow the body to remember when the body is attacked by the similar virus in the future. And there's also a third arm, the killer cells, that identify infected cells and destroys them. So there's multifaceted arm to the vaccine protection. So the general consensus, even at this very early stage, is that even if this escapes antibody protection, the residual protection that you get from the vaccination is still protective of serious illness and hospitalizations and potentially deaths. At the moment, as I mentioned earlier, much of the cases that we have seen have been with mild symptoms, and the symptoms that we see do not mirror the typical COVID symptoms that we have been told to expect. So in this instance, there is much more of fatigue, severe fatigue associated with this variant than other variants, less so of loss of taste and smell. What can we do to keep ourselves safe from this variant and this virus? As mentioned several times in the past, the single most important thing that anybody can do to protect themselves from this variant and others still is to get vaccinated. As I've explained earlier on, vaccines provide multiple layers of protection. So even if it manages to breach one layer, there are still several layers of protection that the vaccine offers. This virus is still basically a piece of RNA surrounded by fat lobules and with spiky points coming out of it. Washing your hands for 20 seconds at a time with soap and warm water dissolves that fat layer and destroys the virus, so you are less able to transmit that. So regular washing of hands or sanitizing your hands with alcohol gel will kill this virus. It's important to continue to maintain the physical distancing. 6 feet significantly between people significantly reduces the efficiency of this virus in transmitting between individuals. It's also important that we continue to wear our face masks because we're less able to spread respiratory droplets that this virus can get transmitted by. If you cough into your elbow, and that reduces the chances that your hands get contaminated and you touching other surfaces that may infect other people. If you are ill, please stay at home. This is very important. We have seen this on several occasions on this island where people have gone to work while they are ill and unfortunately infected so many of their co-workers. As much as possible, avoid touching your face and your eyes and your mouth and your nose. This is the easiest way of transmitting virus into your body, through the mouth, the nose, and the eyes. And avoid crowded places. Finally, I'd like to talk a little bit about what isolation and quarantine involves. If you've been told that you are ill, or you have been a close contact of someone who's been ill, we expect you to isolate if you're ill, or if you're a close contact of somebody who's been ill, we expect you to quarantine. What that means in practical terms is you need to stay in a separate room from other people, and at the minimum sleep on a separate bed, use different bathrooms from others. So all the people in that household, if they cannot separate, would need to be in quarantine or isolation, as the case may be, with the individual. It's important that while if the separation is possible in the house, people maintain the distance of at least 6 feet from each other. They wear masks. They clean all the surfaces, high touch point areas immediately after use. And practical things like the person who is isolating, if there's only one bathroom in the house, will be the last person to use the bathroom, and then the whole bathroom is washed and wiped down after the person has used it before anybody else uses it. And if there's any change in your symptoms, call up your doctor and let them know, and they understand your medical history, and they'll be able to advise on what is important and what you need to do. This is also particularly important for people who are in quarantine. If your symptoms change, please let the contact tracers know so that you can get tested early. And your status can be determined and the appropriate treatment started. Thank you very much. I will now hand over to Dr. Weldon.
Good afternoon, Bermuda. I am pleased to share with you an update of Bermuda's current ability to detect new coronavirus variants. To recap, as of March 2021, Bermuda can identify certain strains using a 1-hour PCR test. Currently, MDL has 7 different tests that target 9 different positions where mutations are within the S gene or spike protein of the virus. The limitation is that these tests only look at 9 positions and not the entire sequence. As certain mutations are shared between multiple variants of concern, the confirmation of a certain mutation being present does not automatically confirm the variant. In addition, it has been shown that some alpha and delta lineages share many of the mutations with this new Omicron variant. Luckily, there are some unique mutations found in Omicron, and our current variant test can identify 3 of them. Nevertheless, to dispel any doubt, viral whole genome sequencing is needed to get the full confirmation. I am pleased to inform that as of this weekend, Bermuda can conduct viral whole genome sequencing on island using nanopore sequencing technology. This meant that upon the variant PCR results at 6 p.m. on Sunday, indicating that the case was highly likely to be Omicron, MDL was able to start genome sequencing within the hour. The sample was prepped for sequencing within 6 hours and ran overnight with data sent for analysis in New York first thing Monday morning. Now that sequencing has confirmed this first case, as well as knowing what the corresponding results for Omicron look like on all of our variant tests, we can now confirm an Omicron case within an hour using the variant test. The ability for MDL to now do nanopore sequencing of this case was made possible through the collaboration between MDL and the Weill Cornell Medical Center in New York. More specifically, this is due to our partnership with the lab of Dr. Chris Mason, Associate Professor and a fellow RNA scientist. Prior to this weekend, we were missing some of the pieces to the puzzle for nanopore sequencing, and Dr. Mason graciously sent a member of his team to Bermuda, which allowed us to officially begin on-island sequencing. I am particularly excited about this development as prior to joining Bermuda's COVID-19 pandemic response team, I myself was performing nanopore sequencing at Oxford University. Going forward, we are looking to establish a long-term collaboration with the Cornell University and the New York Genome Center, who can sequence thousands of samples at a time as opposed to the 20 samples per month that we can currently send to CARFA. With the support from the Mason Lab, MDL will be equipped to sequence on island any of the unordinary cases that may be detected from our variant test within a matter of hours. This is a great opportunity for young Bermudians on all fronts, as during this past weekend, the lab staff at MDL were able to shadow myself and the other lab scientists from the Mason Lab as we performed the sequencing, and a young Bermudian computer engineering graduate will be trained by the Mason Lab bioinformatician how to conduct the analysis this week. In closing, Bermuda now officially has the capacity to do on-island nanopore sequencing, which adds yet another tool in our toolbox in this fight against the coronavirus. Thank you.
We will now take questions from the media, and we'll start with Jonathan of the World Gazette. Thank you.
Good afternoon, everyone, and thanks. I guess to begin with, so we have one case of the new variant. Are you able to tell us when this person tested positive for it, if it was on arrival, or can you say specifically when and where they come from?
Well, what we can say is it was a traveler.
And presumably the privacy and what have you, you can't go into further details?
You're absolutely right, yes.
Okay, I've got you on that.
You can add, Minister, that we tested them on arrival.
Okay, so
Yeah.
it was an arrival test.
Yes.
I believe, Dr. Weldon, you mentioned 6 p.m. on Sunday, am I correct? Or?
That's how we did our
Oh, okay, right. I'll move on. You described, yes, they're quarantining, okay. I'm presuming all the advice that you've received from Public Health England, we now know that would have been what you said just now, Dr. Oyinloye. Okay. Are you able to give us any figures on the take-up of the booster shot and any breakdown of demographics in those who've received the third shot?
I don't have do you have the demographics?
I don't have the demographics on top of my head, but the headline figures that we had as of yesterday was 24% of the islanders had their booster shots.
I guess, how satisfied are you with those figures? Does it look like we're getting more accepting of the shot?
That we could always do more, but the progress we're making is I think is encouraging. More and more people are seeing the benefits of this, and more people are choosing to be protected before we enter the holiday season. So, yes, I'm happy with it. Could we do more? Absolutely, yes. And I would encourage people, if you have not been, if you've not booked your vaccination, please do so. You heard the minister say that things would change from next year. So as much as possible, try and get your booster vaccinations, if you're eligible for it, this side of Christmas.
Got it. We had seen some restrictions get relaxed just before this Omicron came around. Obviously, it's early days, but we're going to have students coming back for Christmas. Are you thinking of potential restrictions if our numbers start rising, having people in family bubbles for Christmas? Can you speak to that? Bearing in mind it's early on.
Sure, it is very early on, and you're absolutely right, Jonathan. Those are matters that are discussed regularly at the cabinet table with the input from health. We have indicators, as I've spoken about previously, that would indicate when we would address certain rollback measures. We are encouraged by the fact that, we are encouraging people, to continue with the public health measures, but we have to kind of play a wait-and-see game, and our hope is that people will adhere to those public health measures and recognize that things like big bubbles and so forth can exacerbate potential spread. You'll still recall that persons that arrive in Bermuda that are not fully immunized are required to quarantine, so that's obviously yet another border control that we have with respect to keeping Bermuda as safe as possible.
Are we still going to be accepting antigen tests as pre-arrival tests?
That was announced on Friday when we made the amendments. I think it's number 7 amendment was announced, and we are working to roll that particular initiative out. But the amendment was made last week, as you're correctly to say that a person that arrives in Bermuda can either have a real-time PCR or an observed antigen test. However, when we will actually start operationalizing that needs to be determined.
Good to hear. Okay. Mr. Burt had said this, the Premier had said this during the fourth wave. He was unhappy with people's behavior, that people weren't following rules. And we did hear some reference to things getting toughened up in terms of bringing people before the courts for flouting the rules.
Mm-hmm.
Is there any update on that? It seems like that's gone quiet for a while.
You note that under the Ministry of Health, we actually have a compliance team, and at last count, I believe there are 24 files that have been completed at varying stages. Some of them have commenced prosecution, some of them are with the police so that the DPP can make a determination on charging, and some of them are in the final stages of gathering the evidence.
Thank you. Okay. My last one for me. In November, we heard it announced that potentially it was something that was being considered by Cabinet. There could be compulsory COVID-19 vaccinations for health and social services staff. Again, it was potential. Where are we at with that? Are there other things like that that are under consideration? Can you say?
What I can say is that announcement was the headline of the Royal Gazette, and if you read into the details of the Royal Gazette, that was not actually what was said, but that did create a headline. What I have said, and has been the position before, is that we are encouraging individuals to avail themselves of the vaccine. If in doubt, speak to their physician, and the policy with the government at this point is to continue encouraging persons to speak to their physician about vaccinations. Because we all know, as the CMO has just indicated, the importance of vaccinations as it relates to COVID and the disasters that may avail oneself if they do contract COVID.
But that question was incorrect, was it?
The content of the article was correct, but the headline was not.
I'm just concerned about what I asked just now, okay? I don't want to put false information out there. Righto, I'll leave it at that.
Thanks, Jonathan.
Thank you. Thank you, Jonathan. We now welcome the Bermuda Broadcasting Company.
Good afternoon, Minister. Good afternoon, CMO, and good afternoon, Dr. Weldon. Firstly, under current regulations, all visitors 2 years old or older must have a negative pre-arrival test taken within 4 days of arrival in Bermuda, as I understand from the government website. For arrivals to the UK, a negative test has been taken within 48 hours. In the US, it's 24 hours. With the uncertainty at the moment surrounding Omicron, is it likely you may tighten that time frame?
Those are discussions that we continue to have. However, appreciating what the United States has effectively announced a couple days ago, and kudos to the health team because we were able to operationalize that so that we could satisfy the need for persons to be able to have an antigen test before returning to the United States within 24 hours. However, again, we continue to look at this particular phenomenon. Omicron is new, and the COVID committee meets, the Cabinet Subcommittee on COVID meets regularly, and we hear reports from the Chief Medical Officer as well as the health team, and we make decisions as and when they need to be made. But at the same time, it's important to recognize that we are considering all of the information, all the scientific data, et cetera, and if changes need to be made or rollbacks need to be announced, then we'll be announcing that to the public as soon as possible.
If I can answer that, Gary? Yes, so you're absolutely right that the United Kingdom and the United States have very recently changed their requirements for entry, but neither of those countries have an on-arrival test, which we have in Bermuda. That gives us an additional layer of confidence. We don't have to rely on external laboratories in other countries because we can test people on arrival here, and people should be in quarantine until they receive the results of their arrival test. So that gives us an additional layer of confidence that is not available in the jurisdictions you've just mentioned.
And Gary, can I just qualify? The antigen test is 3 days. The PCR is 4 days.
Thank you.
Mm-hmm.
Also, at a press conference on Friday, November 26, you announced a loosening of COVID restrictions, and this was the same day that countries around the world were tightening their COVID rules, even closing borders when after Omicron was announced. On reflection, do you think those November 26 announcements were ill-timed?
No, absolutely not. I think, as I've indicated in my statement, Bermuda has always maintained strong border controls. Many of the countries that started making announcements of rollbacks minimized their border controls when they found themselves in a very desirable state. Notwithstanding that we've had our peaks and valleys and our waves, we have always consistently had tight border controls. That's how you stop it, is by the entry points. So I don't believe that it was ill-founded at all, because we have continued to operate with tight border controls, and there's no direction to suggest that that's going to change. That's the best way we have, the best mitigating tool that we have to minimizing the entry of COVID at our border.
With the one Omicron case that we know we have the test results for the close contacts been gene sequenced so that we know that it hasn't, that variant hasn't spread on the plane? I don't know how many people are in quarantine right now due to that.
So I'll let Dr. Weldon answer about the gene sequencing, but the close contacts of this individual are all in quarantine. They've all tested, the initial tests have all come back as negative, so there is no need to gene sequence negative results.
Of course. And how many of those are in quarantine right now?
I can't confirm the exact number for you, but I don't know that right now, but I can find out. All I know is that all the close contacts have been identified by the team, and they're all in quarantine at the moment.
Okay. To speak to Dr. Weldon's announcement, the implementation of genome sequencing in Bermuda opens up some exciting possibilities. Might we be able to offer support to other island jurisdictions? Could we be an alternative to CARFA? Or am I getting ahead of myself?
Well, it's definitely exciting, and being obviously a researcher and doing this before I came, it feels like I've come back to science in a way. So it's been exciting for me. Can we be another CARFA? I don't think we want to be another CARFA, but can we lend support when people need it? Of course, we want to be able to help everyone that we can. Obviously, keep ourselves safe, and if we need to help others, we can. But that might be getting a bit of ahead of ourselves right now. We're only a few days in. We'll enjoy the first early days. But yeah, I'm excited, and the layup staff are excited to kind of see it all happen, because we've had the machine in the layup since June, but we just haven't been able to use it until this weekend. So we're all elated.
I look forward to finding out more about that in particular. Was the implementation of genome sequencing in Bermuda accelerated over the last week in response to the concerns about Omicron?
Yeah, because we know that Omicron is new, and it has a bunch of mutations that we've never seen before. As I said in my statement, we can only look at 9 positions in the virus with our variant PCR test, but if you can imagine, a lot of the changes are in places we can't see. So it's almost like it's behind our back, as it were, whereas genome sequencing can give us that full 360. And so we wanted to make sure that we could be in a position to move quickly when it potentially was here. So yeah, we wanted to make sure we had everything in our toolbox to identify if we did have a case.
Okay. Thank you. That's my 5, I believe.
Thank you. I have a few questions that were written in from TNN. The first is with reference to the Omicron. Are you concerned that it may impact seniors and students or young people differently? Or what do you think the impact will be?
Right, I'll take that. We don't. The short answer is we don't know yet. It's still very, very early days. We don't know yet. And as I mentioned in my earlier speech, much of the data we have is from South Africa, where the outbreak has been different to most part of the northern hemisphere. So we don't know that yet. But what we know is that there will still be protection offered to people if they are vaccinated properly and at the right time. They've had the booster vaccinations at the right time as well.
Okay, thank you. The next question is, how do you want to tell people, what do you want to tell people about the length of how long COVID is going to be with us? There are people who really believe that it's going to be with us for a while.
That is asking me to look into a crystal ball. Unfortunately, I don't have one. I suppose the analogy I can give is H1N1. H1N1 was declared a pandemic in 2009. We still get H1N1 in our annual flu shots till this year. But it's become endemic. It's no longer a pandemic. We've learned to live with it. And hopefully, this is what's going to happen with this pandemic as well.
Okay, thank you. And the final question is, with the new U.S. regulations or restrictions on testing 24 hours in advance, will Bermudians traveling on the 26th and 27th be able to get tested?
Dr. Weldon?
What was the question?
Just to confirm, you mean of December?
Yes, I'm
so
sorry.
those who are
Yes,
traveling
Christmas.
and need tests on Christmas and Boxing Day?
Yes.
Yes, because the lab never closes.
I guess that's the answer, I guess.
It will be open.
The lab will be open. All right.
Yes.
Thank you.
Honey, can I just clarify something that I may have misunderstood Gary's question? The arrival test for Bermuda can either be a PCR or an antigen test. That was gazetted on Friday, so that is in fact in force. So the antigen test has to be 3 days out, PCR 4 days out. But either one of them are acceptable for entry in Bermuda. But if you look at the regulations, they have to be, it's a controlled antigen. It has to be supervised. You can't just go to Walmart and take it off the shelf and then, yeah, exactly. And it still has to be uploaded to your TA. So that would have commenced on December 3rd. Thank you.
Okay. Thank you. Does anyone, Minister, Dr. Ayo, Dr. Weldon, do you have anything you'd like to say before we end? No?
No, I think it is exciting. You could see the look and this grin on Dr. Weldon's face as she spoke about something that most of us don't know. But in any event, it is exciting that Bermuda now has the capabilities to be able to detect the Omicron variant very, very quickly. And again, we need to encourage everyone that it is very important for you to adhere to the public health guidelines, as well as recognize that notwithstanding the fact that our numbers of positive cases are reducing and they're looking good, and we've had CDC ratings change, we still are in the midst of a pandemic. And as we head into the festive season, where more people probably would like to do a little bit more socializing indoors as well, we need to be mindful of the fact that there are still public health measures that we must all adhere to so that we can keep everyone as safe as possible. Thank you.
Thank you, Minister. That concludes today's press conference.